Hello, my name is Charles Posky. I'm a nursing student here at South Alabama, and today, before the Indwelling Catheter assessment, to get started, I'm going to verify the order and then verify hospital policies. I'm also going to have my friend scan the room for me. So to get started, like I said, I'm going to perform hand hygiene. I'm going to verify the order, verify hospital policies. I'm also going to use two patient identifiers, Jaguar Jones, date of birth 0825 1963, 0825 1963. Allergies, penicillin, allergies are penicillin. I'm also going to state the three indicators for the indwelling catheter, and it's going to be requires immobilization for surgery, trauma, and other therapies. Strict urinary output monitoring as indicated by plan of care, hourly monitoring of urine output to guide volume, resuscitation, hemodynamic instability requiring vasopressors and high dose of diuretic therapy. So now I've done that, I'm going to gather my equipment, perform hand hygiene, place my trash can beside me, and I'm going to don goggles, and then I'm going to don clean gloves, and then next I'm going to position the patient. I'm going to raise the bed, lower the side rails, position the patient into the dorsal recumbent, and then I'm going to also make sure they're comfortable. I'm now going to clean with the perineal care, where I'll use water and soap. So for males, I'll have to put them in a supine position. I'll grab by the shaft and I'll clean the urethra medius, and then I'll clean from the inside and then circular motion to the outside, and then grab a new cloth, pat it dry. Next, I'll grab another cloth, dop it in water and soap, and I'll clean the shaft from downward of the shaft, and then I'll grab another cloth and clean the scrotum, and then after that, I'll then grab a dry cloth and pat down the shaft and scrotum. And then for women, I will have for ladies, I'll grab the excess flaps, and I'll go from up to down on the flaps from outside to the inside to the perineal to the rectum. And then after that, I would pat it down dry. I use the next cloth to spread the labia, clean from the outside, throw it away, clean from the inside, throw it away, and then clean from the middle of the urethra orifice, and then have the urethra exposed as well, and clean that, and then dap it dry. And then after that, I'm going to remove my gloves. I'm going to perform hand hygiene, and then I'm going to open up my catheter kit. I'm just going to shift it out like so. Now I'm going to don clean gloves and then perform hand hygiene. Grab from the 1-inch borders. Grab from the cusp. Grab from inside the cusp. Like so. Next, I'm gonna grab my sterile drape. Place it onto my field, grab from the middle. Next, I'm going to grab my the ferment drape. I'm not going to be using it. Usually it's to cover the genitalia, provide privacy for the patient. So I'm just going to place that to the side. Next, I'm going to grab my tray, place it onto the sterile field. Next, I'm going to add betadine to my cotton balls, and then add a lubricant to my tray as well. Next, I will use my 10 milliliter syringe of water and place it into my catheter like so. And then I'm going to take the plastic cover off on my catheter, and then I'm going to lubricate it. I'm going to lubricate it. For females, it's 1 to 2 inches, and for males, it's 5 to 7 inches. So now I have that, I'm now going to clean the genitalia. So how I'm going to do it is that I'm going to spread the labia, grab my first cotton ball, and clean from the outside. I'm going to throw it away. Next one, clean on the inside, then throw it away. And then grab the last one, clean the middle of the labia, throw it away. Now that I've done that, I'm going to start to move my box over to the sterile field, and then I'm going to insert the catheter into the urethra. Before then, I'm going to instruct the patient that I'm going to insert the catheter into the urethra, and that's so it's going to have her bear down, and I'm going to have her to breathe deeply and exhale slowly as I enter the catheter into the urethra. For females, I'm going to push 2 inches in until I see urine come out, and it's 5 to 7 inches until I get to the bifurcation for males. So now I've done that, I'm now going to inject. I'm now going to inject saline. After I do that, I'm going to unclamp it and place it back on my tray. So now I've done that, I'm now going to I removed the syringe. I got the bulb, and I'm going to pull it out till I reach resistance, and then I'm going to push it back in to make sure that it's on. And then now I'm going to place my stack lock on to my patient's thigh to secure the catheter. Place it in like so. I'm going to close it, and I'm going to place the stack lock onto the inner thigh of the patient, so I don't have any urethra trauma, so it won't be pulling on the urethra. So now I'm going to show you how to take it back off. I'm going to clip it like so. And then now I'm going to show you where to place the bag. You're supposed to place the bag onto the bed frame, not onto the bed rail. and it's going to be below the bladder, and that's how you're going to collect your urine. And to get the urine out of the bag, you collect the urine out of the bag when you first enter the catheter, and you just pull it out, and then you have a cup here. And then you just rinse it in there, cut it off, and then put the cap back on. And then you place this back into the bag. Next, to also withdraw it, you use a syringe, and then you would enter it through this port right here, and then you kink it. Kink it, place the syringe in there, withdraw it, and then place it into the collector as well. Next, I'm going to then place the bed back into, actually I'm going to discard my equipment and remove my sterile gloves. So I'm going to grab from the inside and then grab from the inside of my gloves like so. And then I'm going to discard them. After that, I'm going to document the catheter size, document the amount, color, consistency of urine, patient's procedure. I'm also going to lower the bed, raise the side rails, make sure the patient's comfortable, also place a call light to them, have everything for them, and then I'm going to perform hand hygiene, and then that's when I document for the catheter size, mount, color, procedure, specimen collection, and if the catheter is working. And then now I'm going to discontinue the catheter, where I'll use the asepsis technique, where I'm going to be having my goggles on, and then have my perform hand hygiene. And so how I'm going to do it is that I'm going to use my syringe, and I'm going to withdraw it from the bulb and use gravity to take out the water. And then after that, I'm going to take it off, put the cap back on. The whole time I have clean gloves on, and I'm going to perform perineal care again, where, like I said, spread the labia, clean from the inside, from the outside, and then I'm going to first remove the catheter, and then I'll perform perineal care, where I'll clean from outside to the inside to the middle and then pat it dry. And then I'm going to document the assessment, where the amount, color, consistency, smell, also going to explain the patient the effects of like a UTI. So some of the symptoms is just like pelvic pain, blood and urine, have the urge to pee but can't, and then assess the patient, voiding with hours of the patient, 4 to 6 hours, and not voided. I'm going to palpate the bladder and obtain a bladder scan, and that would be end of my assessment.